Hello, my name is Judith Cutchin. I'm an active nurse just like you, and I'm the president of New York State Nurses Association at Health and Hospitals and Mayorals. I am here to welcome you to our organization. It's wonderful that you're here.
Hi, my name is Seth Trasecki, and I'm a nurse practitioner here in New York City. I'm here to talk to you about your union, the New York State Nurses Association, NYSNA, and all the great things that generations of nurses have been able to achieve with our organization. The first thing to remember is that NYSNA is the professional association for registered nurses in New York State. With our nursing practice and policy departments, NYSNA is instrumental in working with the State Board of Nursing and Department of Health to ensure that our practice and our patients are protected. Being an RN means being a patient advocate, and we take that role very seriously by fighting to make sure that our patients have access to care and ensuring that there are safe staffing ratios. Patients are our first priority.
You can talk with me. You can stop and take more time with me than just nursing care.
It just gives you hope. It gives you a sense of you're going to get better.
When you have someone that's making sure you're good, it makes you feel better, like, you know, someone cares.
There's so many reasons to join a union. Number one is benefits.
You have a union that says, we're gonna make sure these hospitals hire you. And guess what? Not only are we gonna hire you, but we're gonna pay for you to go back to school.
My bachelor's is paid for, and currently my master's is being paid for, and I'm almost done.
Being in a union means great wages. Every year we get a guaranteed annual increase, and then we get a cost of living increase on top of that.
NYSNA provides us not only with we staying at one level, we move. As we move up the ladder, you get better education, and we negotiate for better salary.
One of the great benefits of being in NYSNA is having a pension plan.
The healthcare benefits, you go to the doctors, you don't have to pay a lot of money for your coverage.
Even our family is covered, like our spouse, our kids. If they don't have another insurance, of course, they're covered under our insurance.
Thanks to NYSNA, I know that we now have $3,500 to spend for childcare and elder care, and that's amazing.
There's job security when you join a union.
As a member of a union, I have a collective bargaining power that I didn't have on any grounds when I accepted a job offer in a non-union facility.
We've experienced it at our hospital when we had a union that was closed, and the decision was made to lay off a lot of workers in order to meet the financial goals. NYSNA, along with the nurses, took the stand that absolutely not. Not one registered nurse was laid off.
NYSNA has really empowered nurses on how to advocate for their patient, fight for their patient, and make management to be aware if something is not being done the right way.
Management wants to reduce costs, which may sound like a good thing, but in actuality, it's not safe for you or your patients. Being a part of the union allows you to support safer staffing ratios, being able to honestly get your breaks each and every time you come to work, and then letting others know how to advocate as well so that they can join us in our struggles. Right now, the safety of your job is under attack from corporate interests.
There's now this huge attack on unions across the country.
Being a part of the union, we're basically leveling the playing fields against these large corporations who have tons of money and a lot of power.
The only way to protect ourselves and protect our families and protect our patients is to unionize.
Strength is in numbers. The stronger we get and bigger we get, it's the more we realize our union cannot break.
The way we fight for all these benefits requires time and money, and we fund these battles with dues. Dues are the ammunition with which we fight for patients and ourselves, but it only works if everybody is involved. But the most important point I want to make today is that we, the nurses, are NYSNA. Together, we have each other's back. In front of you, you should have a list of delegates. These are nurses just like you to help guide you in your journey here. If you have questions or concerns about anything here, reach out to one of them. Questions about benefits, education, heck, even where the break room is located, ask them. You are important, and we're glad that you're here.
You can't be a nurse by yourself. It takes a village to be
to really care for our community.
We are upstate, downstate, all around town. We have over 42,000 nurses in NYSNA.
You are the union. It's you that's the union. It's not a building, it's not a fictitious individual, it's you who make the union and your participation. You may have something to offer that no one else there has.
We are women, we are Black, white, Asian, we are Afro-Caribbean, we are Filipina, like we are from everywhere.
Let's recap. NYSNA is the professional organization for RNs in New York State that allows us to fight for patients and ourselves. We have spent years improving wages and benefits, and these are guaranteed in our contract. We, the nurses, are NYSNA, and we are here for you. Our organization only works if everybody's involved, so we need you. So, what can you do right now to protect your practice and all we work for? The first thing you can do is sign up to be a member. Sign the card in front of you. The second thing is to reach out to your delegates. This way, we can keep you updated about everything here and about your practice. Finally, come to a meeting. We have union meetings every month, and sometimes we even have pizza. Join us.
We are nurses. We are NYSNA.